when it's lunchtime, are you eating your lunch in front of a computer, like while you're having a meeting and not even taking a couple of deep breaths? Or can you, take 45 minutes out of your day, stop being productive and actually just be outside, listen to the birds and eat your lunch in the sunshine without a screen in front of you? So it's retraining your brain around those things.
I'm Riley Reese. This is the Sofia Unfiltered Podcast, where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go. Hi, everyone, and welcome back to another Sofia Unfiltered. I'm your host, Riley Reese, and today, Dr. Allie McLane is joining us. She's a naturopathic doctor who specializes in women's gut, mental, and hormonal health. Dr. Allie, thank you so much for being here and chatting, especially about women's health.
Thank you for having me. Honored to be here.
Yeah. So for all of our listeners who may not know you yet, can you just tell us a little bit about your background?
Yeah. So I am a naturopathic doctor licensed in the state of California, and I specialize in women's health, specifically the intersection between mental health, hormones, and gut health. My typical patient that I work with usually has concerns in all three of those areas. And believe it or not, they're actually all connected. They're interconnected. So my approach is to address all of those things simultaneously. And that's really where I see people getting the best results.
Yeah. So we love holistic health. We're obviously big believers in it over here. And so we're talking today specifically about anxiety. And you're saying the gut health, mental health, and hormonal health are all tied together.
Absolutely. Yeah, very much so.
Yeah. So this sounds like you've got some, I would say revolutionary, but, breakthrough information for us.
Yeah.
Where should we dive in on this topic?
Yeah. So, a lot of this stems back to the roots of naturopathic medicine. And not just naturopathic medicine, but a lot of Ayurveda as well has this view, which is that really all health kind of starts in the gut. And so when I say gut, that is a very general term, right? What do I mean when I say gut? Our gut is comprised of a lot of organs. It's comprised of our intestines, our stomach, small intestine, large intestine, liver, some might say pancreas. So there's a lot of things going on in that region of the body already. And what the gut is it's an interface between our internal world and our external world. So it's a tube essentially that goes from mouth to anus, and it is inside of our body, but technically it's actually outside of our body, right? Because we have this lining of our gut that is the barrier to entry. And so what happens is in a lot of people, due to a multitude of causes, stress probably being the primary one, medications, we start to have a disruption in that barrier. And at that point, we see all kinds of things go haywire, from our immune system to our just our overall vitality. We also have a nervous system that is in our gut. It's called the enteric nervous system. And that is very much in communication with our brain. And many people might already know this, but that communication is bidirectional. So what is speaking from our brain to our gut is also coming back from our gut to our brain. So when we're addressing mental health, we have to keep this in mind. There is constant signaling and communication coming from the gut. And if we're just addressing mental health from the standpoint of, let's get the serotonin a little bit higher, or let's get the GABA a little bit higher, or the progesterone, all of those things are important. But if we're neglecting gut health, then we're really not addressing the whole picture. And that person probably isn't going to get better.
Yeah. So for our listeners, can you tell us a little bit about what that could look like when somebody goes into the doctor? We hear this time and time again, right? Serotonin's low, you take a pill, you're good. Why is that not the solution? And what would you do differently?
Yeah. And it's unfortunate. So what I explain to people is that anxiety has more than one root cause. Rarely is it ever just one thing. So sometimes there might be low serotonin activity. That is one type of anxiety, right? But alongside that low serotonin activity, there's probably other root causes that are happening simultaneously. So even if it is low serotonin activity and we just address that, we have to think of like why that's happening, right?
Can you tell us like what else could be going on, or what are some of the other root causes that
Yeah.
people listening may say, oh, just so
Yeah,
that they can think about?
absolutely. So I like to put it into 4 different categories.
Wait.
The first category would be hormones, right? And that's kind of a broad category, but that's one. The second would be gut health, also a broad category. The third would be nervous system dysregulation. And then the fourth would be biochemical imbalances, which really means your unique need for particular vitamins, amino acids, and minerals. And everyone is going to have a different need based on their genetics and their biochemistry.
Okay, so these 4 buckets: gut health, hormones,
nervous system, and then biochemical stuff, or let's just say vitamins and minerals.
How often do you think this is broken down at the doctor's office? I mean, for people to really understand. Okay, so what does that mean if we're in one of these buckets? Because I can imagine our listeners are like, how am I ever going to figure this out?
Absolutely. Yeah. So the best thing that you can do is start with each of those areas in even the smallest way possible, right? So your hormones tend to be the higher level thing that I would address last, in terms of sex hormones like progesterone and estrogen, because those tend to be affected by other things. But cortisol, or your stress hormones, those tend to be more of a primary cause, right? So to address that bucket, I would focus on, and we can talk about, kind of starting points for each of these buckets. I would start with addressing your cortisol, or addressing your circadian rhythm, right? So this is sleep hygiene, and even just how you're moving through your day, right? So are you a person that exercises at 8 p.m., when you get off of work? Well, that's increasing your cortisol at night, which is throwing off your circadian rhythm. Are you going outside and getting sunlight in your eyes in the morning? Those are important things, all foundational things that you can do. And then in terms of your gut health, I mean, it depends on what symptoms you're presenting with. And, as a general rule of thumb, if you have things like gas, bloating, other digestive concerns, you can start by trying to address those things with diet and lifestyle. If they don't resolve, then you probably need some further testing and workup, right? Because it could be something like a SIBO. It could be something like any kind of bacterial overgrowth or fungal overgrowth, and those things probably need further treatment. But in some people, it really is more functional, right? They really are not eating a proper diet with the proper amount of fiber, the proper amount of protein. So starting with the basis of aiming to have 20 to 30 grams of fiber per day. If you're a person with gut issues, you might not be tolerant of that, right? So there are things to address prior to getting to that point. And then eating foods that are obviously not inflammatory to your body. And this is where bioindividuality comes in, right? Because some people are going to tolerate eggs just fine, and in other people, it's going to be a problem. The gold standard for that is to actually just eliminate the main food allergens that people have, or food intolerances, I should say, which would be eggs, which would be gluten, which would be dairy and soy. And going off of those for an extended period of time, a few weeks to a month, and then reintroducing them one at a time to see if they're causing a problem, right? So implementing some of those strategies and seeing if your gut health improves. I also like to use Ayurveda as well. So if somebody has a lot of gas and bloating, maybe not drinking a lot of cold water, eating a lot of cold foods, incorporating more cooked foods, incorporating more warming foods, more spices, more tea in between meals, like ginger tea is great. And so if you do all of those things and you're still having issues, probably a good time, to see a naturopathic doctor and get worked up for that. So that's the gut health bucket. We talked about hormones, we talked about gut. Vitamins and minerals is a lot more bioindividual, and that's another higher level thing that I would reserve for somebody who, has lab work. I have a lot of people that come to me and, they're taking a B complex because they were told that a B complex is good, or, maybe they've had genetic testing and they're like, I need methylated B vitamins, and they feel better for a short period of time and then they feel worse. And there's reasons for that. And that's stuff that we can see when we're doing blood work. And so again, not everyone is going to need that high of a level of intervention, Implementing the basics is the great place to start, and then moving forward from there. The fourth category would be nervous system regulation, right? So nervous system regulation kind of ties into cortisol in that it's how you're moving through your day. A lot of times people are moving through their day in a very rushed, especially the women that I work with who have anxiety, very rushed, very stressed. There's just a sense of not feeling grounded in their body, right? And so the way that we start to shift those things is we start to change the way that we move through our day and create little pattern interruptions. So I work with people, to do that. Sometimes people hear nervous system regulation and they automatically go to, cold plunge or breath work, some of the more trendy things right now. And those things can be great, but it also can just be like, when it's lunchtime, are you eating your lunch in front of a computer, like while you're having a meeting and not even taking a couple of deep breaths? Or can you, take 45 minutes out of your day, stop being productive and actually just be outside, listen to the birds and eat your lunch in the sunshine without a screen in front of you? So it's retraining your brain around those things. So
when you say it like that, you're really kind of bringing this back to basics. I mean, I know these are four really broad categories, but I just don't hear this very often, right? From the doctor, like, we're going to take a look at, when you're exercising, when you're eating, and how you're sleeping. Like, we hear this from the holistic, from practitioners all the time. How do you start your client assessment? Are you really starting out with, tell me how you sleep? What?
Absolutely. Yeah. Yeah. I mean, it's pretty standard, like naturopathic comprehensive intake, because in naturopathic medicine, we call those things the determinants of health, right? And if you don't have that foundation, we really don't have anything to build on. So, a lot of people will want a quick fix, right? Because we're in a society where quick fixes are marketed.
Absolutely. Absolutely. Quick pills, quick fix, instant hits.
Yeah. And I explain to people that's not how this works, right? That's if you actually want a long-term solution and you don't want to be reliant on things and you want to have your own internal resources to shift the way that your body's feeling and to shift some of these symptoms, then it really does take work. It really does. It's heavy on the lifestyle. And I'm all about living your life as a medicinal life, making your life your medicine. We truly have to change the person that we're showing up as in the world if we want to change our outcome. Of course, if somebody wants to lose weight, they can go and get Ozempic. Sure, no shame to them. There are side effects that are associated with that, right? And it's a given.
And we hear that the minute you come off that the weight's going to come back. I don't know if that's true, but so sometimes these quick fixes are not sustainable.
Exactly. And that's what I'm all about is sustainability, especially when it comes to anxiety, because anxiety tends to be something that is passed down, right? Women that I work with, like their mothers had it, their grandmothers had it. Half of the women in their family are on medications and they believe that that is their only option because that's the only thing around them. And so that takes a lot of work to transform and to shift. It's totally possible. And I've seen it done. And it's what I love doing the most is getting people to that point. And, not everyone will commit. Not everyone will reach that point. And so it's hard to hold the line in that sense. But even if somebody doesn't get quote unquote all the way there, they can still get a great portion of the way there just by changing some things, right? We're never aiming for perfection. We're just aiming for like, how can I just be 1% better every day?
It's really incredible. And it seems so foundational. And you've actually seen people be able to adjust their diet and lifestyle.
Yeah.
And reduce their anxiety.
100%. Yeah. All the time.
Okay. So we know it's possible. So this mind-body connection and with our gut, can you speak a little bit more to that on why, what we eat and how our stomach and what our stomach is telling us, how does this affect our mental health?
Yeah. So there's a couple of different mechanisms in which that can occur. I would say the primary thing is if there is inflammation is such a general term, but if there is inflammation in your gut, right, that inflammation can be coming from undigested food particles that, your body's not agreeing with, or you had the wrong combination of food. It could be a dysbiosis, which means overgrowth of bacteria, and those bacteria release little inflammatory things. And so those inflammatory signals are going to your brain and they're sending kind of like a danger signal to your brain. So that is kind of the primary way.
And that's what tells us to have anxiety.
Yeah, it can.
For example.
It can. Yeah.
So what we're eating could actually, and how our gut is, the big gut, all the components, it could seriously be sending messages and putting you in a state of anxiousness because of inflammation.
Yeah. So I would say it's more of a nuance than that, right? Because what you're eating is also going to impact your blood sugar, right? So if you're eating a meal that doesn't have enough protein and a lot of carbs, and carbs are not the devil, by the way. I love carbs. Like, a lot of women don't eat enough carbs, and I see them having issues with energy. But having proper, macronutrient ratios, if your blood sugar is all dysregulated and all over the place, then that's absolutely going to increase cortisol, epinephrine, which is essentially adrenaline, and increase anxiety. I've seen food intolerances cause anxiety. I've seen people eat a food that, can increase their heart rate. For celiac disease is a good example, and that this is more of an extreme example. Somebody who has a pretty severe autoimmune disease, but celiac disease sometimes doesn't even present in the gut. Like with gut symptoms, it might just be very mild, and sometimes it presents more with psychiatric symptoms. So like, psychosis, anxiety, panic, and people have this for years, and then they realize that they have celiac disease and it's been undiagnosed. So that's an example of inflammation causing brain inflammation, causing symptoms. It's going to be different in every person, right? I don't want people to be afraid of food, because I'm careful around saying that, because I don't want people to be like, well, I don't know what to eat, I'm so scared. There's a lot of people with food fear. They see other practitioners and they do these tests and they're like, oh, I can't eat anything, and I'm so terrified. And that's kind of the opposite of what the goal is. The goal is for you to feel safe in your body, and for you to be able to be like, okay, like, I feel confident. I know that this food is okay for me. And there might be a few foods that are not okay for you, but rather than focusing on the things that are not okay and having anxiety about that, let's focus on, the empowerment of knowing what it is that we can put in our body that will help us feel good. So it's that mindset shift. And I just want to be careful, with your listeners, if they're hearing this and they're like, oh, there's food that can give me anxiety, I'm so anxious. It's not like that, right? There's always going to be a more optimal diet for an individual.
But it sounds like, kind of everything in regulation. And then if you have something, maybe that's making you not feel good, whether it's your mental health or your gut's not feeling good. A lot of people have, the bloating, the gas and bloating, and sometimes constantly. It just sounds like it would be good to get in touch with the naturopathic, holistic, functional practitioners who can really look at the root cause, especially with anxiety. A lot of people could potentially be listening and just be given, medication to take for pills. But, to think about the listeners who could have been misdiagnosed or just not diagnosed with a mental health condition, and it was something like SIBO. Yeah, that's just something you don't want to live with. Like, I would want to get that checked out right away. Like, find out what's actually going on. Like, hey,
100%.
Don't have this anxiety. Yeah, absolutely. Are there strategies that you recommend to people, on the lifestyle changes?
Mm-hmm.
Besides sleeping, are there to really improve that mind-body connection?
Yeah.
I mean, you mentioned breath work.
Yeah. Breath work can be helpful. I think the important thing is that we are not too rigid with whatever it is. And we're not like, it has to be like this. It's more about taking what you are already doing and just making it a better version of that. Right. So you're already waking up in the morning and making yourself a cup of tea. So how can we make that a better version of that? You're probably waking up and making yourself a cup of tea and then sitting in front of your computer and like answering emails right away, like not even going outside. So can you make yourself a cup of tea, go outside, get some sun on your skin for 5 to 10 minutes, without a screen, just take some deep breaths, practice not doing anything. I think the anxious mind is so fixated on what's the next distraction that I can distract myself with. We're addicted to screens. We're addicted to phones. So the only way that you can get unaddicted to that is to practice the use of not doing that, right? So having this intentional time, and during that time, you might notice that you start having resistance, right? You might notice that you're feeling uneasy because you're like thinking of all the things that you have to do. This is a form of meditation without actually sitting down and meditating, right? You can sit down and meditate, and that's amazing. I love transcendental meditation. I do it myself, but not everyone is there. Not everyone is ready to just sit and be.
I love that you're bringing this up. It's just clearing your mind. It could, tell me if I'm wrong, but it could just be like driving on the road. Like you could just be singing, driving, not thinking about anything else.
Yeah.
I think that's a form of meditation, right? Like anything that's going to calm your mind or make you focus on one thing. I love this. People sometimes think it's a religion, that's just kind of sad. I mean, it's such a free tool to calm your mind and your body.
Exactly. And like when we overcomplicate it, what happens is we create a barrier to entry. So now people are not doing it because they're like, oh, to meditate, I need to, go on Amazon and buy a meditation cushion, and I need to download
this sit a certain way, and I have to pay for this, I have to pay for that. And
no,
it's uncomfortable. Or I have to listen to specific music that I don't like.
Yes.
No, I love that you're bringing this up.
Thank you. Yeah. Yeah. Like all you have to do is just be with yourself without a distraction. That's the main thing, is just not distracting yourself, sitting
scrolling on social media, the news.
Yeah.
List.
Just being with it. And, some people don't feel safe enough to be with whatever it is, because ultimately, like if we sit for long enough, we're going to feel an uncomfortable emotion arise. Like we all have things going on in our personal life. Maybe it's grief, maybe it's fear, whatever that it is, like that is going to come up at some point. So then it's like, and this comes back to nervous system regulation. How do you create the resources to be with the thing that's coming up? How can you sit with that thing? And breath is a great way to do that, right? Recognizing that the emotion is a temporary emotion, as all emotions are. They're coming and then they're going. It's when we attach a story to the emotion, when we attach a deeper meaning and we want to create a narrative around it, we start to hold on to it, and it starts to become a more difficult thing to let go of. So if we can just get into that meditative state, observe the emotion, acknowledge it, don't like try to bypass it and say, oh, that's not real. No, like this is a real thing that I'm feeling, and it's significant, and it makes sense why I'm feeling this way. I'm just going to breathe, and it's going to pass. And it does.
I mean, and it's really hard. I mean, if you put ourselves just to bring an example to the light, like we're talking about, maybe you just had a breakup.
Yeah.
And now you're sitting there and you're like, okay, you could be anxious about this, and I'm trying to clear my mind. And that sadness comes up, or you're reliving these moments, or you want to pick up and relive it with all of your girlfriends or boyfriends out there in the world. And you're just reliving that moment and staying in that moment versus trying to, what you're saying is saying, acknowledge it and then just breathe.
Yeah. Yeah. And knowing
it's really hard. It's really hard.
It is really hard. And that's why it's a practice, right? It's called a meditation practice. There's no perfection in any of this. And, knowing that, especially if it's something like a breakup, those feelings will kind of come back in waves. If it's
at different times of day, right?
Loss of somebody that you love, like that's going to come to you in a wave. And it's really important that in those moments, when you feel that wave of intensity, that you're just with it. You stop what you're doing. You don't pour yourself a glass of wine or take a look at your phone or do whatever, because that's our tendency, is like, oh my God, this is so uncomfortable. Let me, and when we do
distract. So we're trying, our body subconsciously trying to kind of distract us.
Yeah. Which in turn makes it grow bigger and makes it more heavy in our bodies. Right. So if we can just get into the practice of, in the moment, feeling the really uncomfortable emotion, knowing that it is a temporary state, literally nothing lasts forever, feeling the emotion, acknowledging it, giving ourselves the compassion, maybe put your hands on your heart, take a couple of deep breaths. You might like shed a couple of tears. Awesome. Great. We need to shed more tears, right? We need to feel, we need to release. What is coming up for us needs to be processed, not suppressed. So yeah, like that is one of the biggest things that you can do for yourself. And if you do that, you get in that practice, you're going to be doing less of the quote unquote unhealthy things, right? Everyone's like, I want to stop eating sugar, or I want to stop, binging Netflix or whatever. And it's like, okay, I could just tell you like, don't eat sugar. And yeah, maybe there's a component with your blood sugar, and maybe there's something going on with your GABA or whatever. But if we don't address like the fundamental root of what it is that you're experiencing from the psychosomatic emotional level, a lot of those subconscious things are driving our behavior. So this is why I'm about addressing that multifaceted nature of anxiety. We're not just doing the functional medicine, which is awesome and I love it, But that's just one piece of the puzzle.
Yeah, that's amazing. Dr. Allie, thank you so much for being here and sharing these 4 buckets and really expanding on this mind, body, the gut brain connection.
Absolutely.
All of our listeners have been able to learn something from this. Is there anything else that you would like to share with our listeners on anxiety or just health in general? Is there anything you want to, any insights, words of wisdom you have for us?
Yeah. Start with one thing. There's no such thing as perfection. Don't let yourself get overwhelmed by all of the different things. Just think to yourself, what is one thing that I can do today differently? And get really good at doing that one thing and changing that one thing. And once you get good at doing that one thing, you're going to get confidence and belief in yourself that you can make a change. It can literally just be when I wake up in the morning, I open the door, I step outside, I take a deep breath of air, and I spend 2 minutes staring at a bird and a tree or whatever, right?
I mean, that's so simple. That sounds so simple and it sounds accomplishable.
Yes. Don't strive.
It sounds simple. I know some people have a hard time getting out of bed, so I don't want to minimize that. I just mean it's not something where you have to go to the gym. You don't have to pay for anything.
Yeah.
You're able to get out of bed, and we hope that you are, or whoever's out there listening.
Yeah.
We hope you can stand there and take a deep breath in the morning.
Yeah. Just small wins and achievable wins, and you'll build that confidence and belief in yourself. And then you add on the next thing. It's not about getting there tomorrow. It's about creating sustainability and reproducibility.
Yeah, I love that. That's beautiful. Well, there is a question that we ask all the guests on the show. If you could share 3 fundamental pillars that contribute to your well-being.
Okay. Nature, laughter and community. Nature, laughter / community, and nourishing food.
Oh, those are great. Those are great picks. Yeah, laughter, it's so good. Community on the mental health. And that socialness, right? Like we all miss that during COVID. So I love how people are really bringing that into their core pillars. Okay, Dr. Allie, we'll drop this in the show notes, by the way, but where can our listeners connect with you? How can they find you and get more information? I know you have a package and a special offer for everybody. If you could just share that.
Yeah. So I have a membership community right now for women with anxiety. It's a group community. I also have ability to work with me one-on-one. So if you want to work with me, feel free to send me a message. I'm actually the most active on Instagram at Dr. Allie McLane. That's a good place to find me and interact with me. If not, you can find me on my website, dralliemclane.com. And yeah, I would love to chat if you're looking for support.
Well, for everybody out there who's looking for help with anxiety, or they want to dig into the root cause of what might be going on, you can check out Dr. Allie's information, and we will drop it in the show notes. Thank you for being with us today.
Thank you for having me.
Thanks so much for listening. This has been Sofia Unfiltered, a podcast by Sofia Health, the #1 marketplace for health and wellness. Find services, classes, and products from the top health and wellness providers. Book an appointment or join live classes now. I'm your host, Riley Reese. If this episode resonated with you, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway from this episode was, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform how we care for ourselves.